In today's video, we are reeling into the world of diabetes. It's a word that carries weight, a diagnosis that can change lives in an instant. For many, it's a condition managed with careful attention to diet and lifestyle, a constant companion that requires vigilance and care. But for millions of others around the world, diabetes is a silent threat. Please subscribe, like, and share. Diabetes is a growing health concern worldwide, and among African men, it is becoming an increasingly critical issue. The prevalence of diabetes, particularly type 2 diabetes, is rising in many parts of Africa, including among men. Factors contributing to this increase include urbanization, changes in diet and lifestyle, and genetic predisposition. Understanding the challenges and the specific impact of diabetes on African men can help in addressing the issue more effectively. Diabetes has a profound impact not only on the individual diagnosed with the condition, but also on their families. The emotional, financial, and social effects of managing diabetes can ripple through households, creating stress and altering the dynamics of family life. Diabetes is a global health crisis affecting millions across every continent. Diabetes is a chronic condition that affects millions of people worldwide, causing a range of complications if left untreated. In Africa, type 2 diabetes is becoming more common, particularly among men. It is a silent killer, often going undiagnosed until it's too late. Its impact is most acute in low- and middle-income countries. Africa has seen a dramatic rise in diabetes prevalence. The African region has the highest proportion of undiagnosed cases globally. According to the World Health Organization, Africa is home to over 19 million people living with diabetes, and the number continues to rise. Among African men, the risk of developing diabetes is increasing as lifestyles change. This underscores the urgent need for increased awareness and access to care. South Africa has more than 4 million people living with diabetes. Many aren't getting proper treatment. In South Africa, there has been a notable rise in the prevalence of type 2 diabetes in recent years due to changing diets. People are consuming more processed foods, sugary drinks, and high-calorie meals. Diabetes, once considered a disease of affluence, is now rapidly spreading. This alarming trend is particularly pronounced among men. The World Health Organization estimates that the number of adults living with diabetes has more than tripled since 1980. This rise is linked to rapid social, economic, and environmental changes. The disease appears to exact a heavier toll on men, particularly in sub-Saharan Africa. Rapid urbanization and modernization in Africa are significant drivers of the diabetes epidemic. Migration to cities often leads to lifestyle changes that increase diabetes risk. Changes in diet, physical activity, and stress levels contribute to insulin resistance. Traditional diets are being replaced by processed foods, sugary drinks, and unhealthy fats. The availability and marketing of processed foods drive this dietary transition. These foods, though convenient, are low in nutritional value and contribute to weight gain. While the adoption of westernized diets and lifestyles has played a role in rising diabetes in Africa, the story is more nuanced than blaming a single dietary pattern. Genetics, cultural practices, and socioeconomic conditions also contribute to diabetes risks in Africa. Studies show certain genetic predispositions may make Africans more susceptible to insulin resistance, a key factor in type 2 diabetes. Combined with poor nutrition and lack of physical activity, this increases diabetes risk. Cultural practices and body image also influence diabetes risk. Adding another layer of complexity to the diabetes epidemic in Africa is the pervasive issue of health inequality. Access to quality healthcare, including diabetes prevention, diagnosis, and treatment, remains unevenly distributed across the continent, with those living in poverty, rural areas, and marginalized communities facing the greatest barriers. This inequitable access to healthcare contributes to delayed diagnoses, inadequate management, and a higher risk of complications for those affected by diabetes. For many Africans, particularly those living in poverty, the cost of healthcare can be prohibitive, preventing them from seeking timely medical attention. Even when healthcare services are available, they may be located far from where people live, requiring costly and time-consuming travel. This is particularly challenging for individuals in rural areas or those with limited access to transportation. Furthermore, shortages of healthcare professionals, particularly in rural and underserved areas, exacerbate the challenges of accessing quality diabetes care. This shortage is compounded by limited resources, outdated equipment, and a lack of specialized training for healthcare providers in managing chronic conditions like diabetes. In the heart of Africa, a silent transformation is taking place. The rhythms of life are giving way to urbanization and technological advancements. This shift brings progress but also new health challenges. Significant changes lie in diet and lifestyle. Traditional diets are being replaced by a westernized pattern of eating. This transition includes more processed foods and sugary drinks. The rise of processed foods in Africa is a complex issue, driven by a confluence of factors. Globalization has opened the floodgates to a wider array of imported food products, often heavily marketed and perceived as symbols of modernity and affluence. Urbanization, with its fast-paced lifestyle and limited access to fresh produce in certain areas, has further fueled the demand for convenient, ready-to-eat meals. These processed foods, while tempting in their convenience, often lack the essential nutrients found in traditional African diets. They are typically high in calories, unhealthy fats, added sugars, and sodium, while being low in fiber, vitamins, and minerals. This nutritional imbalance can contribute to weight gain, insulin resistance, and an increased risk of developing type 2 diabetes. Moreover, the marketing tactics employed by some food and beverage companies often target vulnerable populations, including those with lower incomes and limited access to health information. This aggressive marketing, coupled with the affordability and accessibility of processed foods, creates a challenging environment for individuals striving to make healthy choices. As African nations continue on the path of economic development and urbanization, the adoption of sedentary lifestyles is becoming increasingly common. The transition from agrarian societies, where physical activity was an integral part of daily life, to more urbanized settings, often involves a shift towards desk jobs, motorized transportation, and leisure activities that involve prolonged sitting. While these advancements bring undeniable benefits, they also contribute to a decline in overall physical activity levels. This decrease in movement, coupled with the consumption of calorie-rich, nutrient-poor diets, creates a perfect storm for the development of weight gain, insulin resistance, and type 2 diabetes. The human body, finely tuned over millennia to thrive on movement, struggles to adapt to this sudden shift towards sedentary living. Muscles, designed for regular activity, weaken, and the body's ability to regulate blood sugar levels becomes compromised. This creates a vicious cycle where inactivity begets further inactivity, increasing the risk of developing diabetes and other chronic health conditions. Beyond the plate, stress, sleep, and social determinants. While diet and exercise play pivotal roles in diabetes, they are not the sole actors. Stress, sleep deprivation, and social determinants also contribute significantly. Stress and sleep deprivation cast long shadows on diabetes risk. Chronic stress disrupts blood sugar regulation, increasing diabetes risk. Sleep is crucial for hormone regulation and blood sugar control. The stigma of silence. In many African cultures, silence often speaks louder than words. It is a language of respect, of tradition, of unspoken understanding. But when it comes to health, this silence can become a dangerous shroud. Diabetes often remains cloaked in this silence. Chronic illnesses like diabetes are perceived as a weakness. This perception pressures men to maintain a stoic facade. Section 2. A Man's Burden, Masculinity and the Mask of Stoicism. Across many African cultures, masculinity is often defined by strength, stoicism, and the ability to provide for one's family. These deeply ingrained societal expectations can create invisible barriers for men seeking help for health concerns, particularly those perceived as undermining these traditional notions of manhood. Diabetes, with its association with lifestyle factors and chronic illness, can clash with these deeply held beliefs. Some men may view a diabetes diagnosis as a sign of weakness or a failure to live up to their expected roles. This internalized stigma can lead to denial, self-blame, and a reluctance to adopt the necessary lifestyle changes or seek medical support. The pressure to conform to these traditional notions of masculinity can be immense, preventing men from openly discussing their health concerns or seeking the emotional support they need. This silence, while seemingly protective, can isolate men, leaving them feeling alone and ill-equipped to navigate the challenges of living with diabetes. Section 3. Bridging the Gap, Traditional Beliefs and Modern Healthcare. The intersection of traditional beliefs and modern healthcare practices presents both challenges and opportunities in addressing the stigma of diabetes among African men. While traditional healers and remedies continue to hold a respected place in many communities, it is crucial to bridge the gap between these time-honored practices and the evidence-based approaches of modern medicine. In some instances, traditional beliefs about diabetes may not align with current scientific understanding, leading to misconceptions about the causes, treatments, and potential complications of the disease. This can create confusion and mistrust, hindering efforts to promote early detection, appropriate management, and prevention strategies. By fostering dialogue and collaboration between healthcare providers and traditional healers, it is possible to create a more holistic and culturally sensitive approach to diabetes care. This can involve incorporating traditional remedies, where appropriate, alongside conventional treatments, and empowering communities to make informed decisions about their health. Sensitivity and respect in these conversations are essential, recognizing the deep cultural significance of traditional healing practices. The power of community, shifting the narrative, embracing change. Breaking down the stigma of diabetes among African men requires a multifaceted approach. It necessitates a collective effort, engaging communities, families, and cultural influencers. Community-based programs led by trusted figures can shift the narrative. These programs provide culturally tailored education and create safe spaces. The power of storytelling should not be underestimated. Sharing personal narratives can dismantle stereotypes and inspire hope. Section 1. The Body Under Siege. Untangling the web of complications. Imagine a spider web, its delicate threads glistening in the morning dew. Now picture those threads as the intricate network of systems within the human body. Diabetes disrupts this balance, leading to complications that impact nearly every organ system. Often described as a silent killer, diabetes' early stages are masked by subtle symptoms. Beneath the surface, the disease wreaks havoc, damaging blood vessels, nerves, and organs. One of the most insidious aspects of diabetes is its impact on blood vessels. The cardiovascular system is particularly vulnerable to the damaging effects of diabetes. High blood sugar levels can lead to a buildup of fatty deposits in the arteries, increasing the risk of heart attack and stroke. Imagine a garden hose slowly becoming clogged with debris. As the passage narrows, less water can flow through. This is similar to what happens in the arteries of someone with diabetes. The buildup of plaque narrows the arteries, reducing blood flow to the heart and brain. The kidneys, those remarkable bean-shaped organs, play a vital role in maintaining the body's internal balance. They remove waste, regulate blood pressure, and produce essential hormones. Diabetes damages blood vessels, threatening these organs. High blood sugar can impair kidney function, leading to diabetic kidney disease. This condition is a leading cause of kidney failure, requiring dialysis or transplantation. While the physical complications of diabetes are well documented, the emotional and psychological toll of the disease is often overlooked. Living with a chronic condition like diabetes can be challenging, requiring constant vigilance in managing blood sugar levels, making lifestyle changes, and coping with the fear of potential complications. The emotional burden of diabetes can manifest in various ways, including stress, anxiety, depression, and even diabetes distress, a specific type of emotional distress related to the demands of managing the condition. These emotional challenges can impact an individual's quality of life, making it difficult to adhere to treatment plans, maintain healthy relationships, and engage in everyday activities. Several factors contribute to the emotional toll of diabetes. The constant need to monitor blood sugar levels, administer insulin injections, and make healthy lifestyle choices can be overwhelming, leading to feelings of burnout and frustration. The fear of complications, particularly those that can impact vision, mobility, or organ function, can also weigh heavily on individuals with diabetes, leading to anxiety and a sense of uncertainty about the future. Turning the tide, a beacon of hope. Amidst the sobering statistics, a beacon of hope emerges. The power to turn the tide lies within reach. Proactive prevention, comprehensive treatment, and community support can rewrite the narrative of diabetes in Africa. Awareness is key, shining a light on silent symptoms and fostering open dialogue. Breaking down stigma encourages early detection and better health outcomes. Prevention is always better than cure. This rings true for diabetes, often developing silently over years. Embracing proactive prevention strategies can empower individuals to reduce their risk. Lifestyle modification is key. Simple changes to diet and exercise can significantly reduce diabetes risk. For those already living with diabetes, effective management becomes paramount. Navigating the labyrinth of diabetes care can be daunting, requiring a multifaceted approach that addresses not only the physical aspects of the disease, but also the emotional, social, and financial challenges it can present. A holistic approach to treatment, one that empowers individuals to become active participants in their own care, is essential for achieving optimal health outcomes. At the core of diabetes management lies a triad of self-care practices: medication adherence, blood sugar monitoring, and healthy lifestyle choices. Working closely with a healthcare team, individuals with diabetes can develop a personalized treatment plan that addresses their unique needs and circumstances. This may include oral medications, insulin injections, or a combination of both, along with regular blood sugar monitoring to track progress and make adjustments as needed. Beyond medication and monitoring, healthy lifestyle choices remain the cornerstone of diabetes management. A balanced diet, regular physical activity, stress management techniques, and adequate sleep are all essential components of a comprehensive approach to living well with diabetes. Addressing the growing burden of diabetes in Africa requires a collective effort. Governments, healthcare providers, and communities must unite to combat this epidemic. Invest in public health infrastructure to ensure access to quality diabetes services. Expand access to affordable medications and culturally sensitive education. Train more healthcare providers in diabetes care. Efforts must extend beyond clinics to empower communities. Equip communities with knowledge and resources to promote healthy lifestyles. Diabetes isn't just a physical condition. It's an emotional journey, not only for the person diagnosed, but also for their loved ones. The stress of managing the disease, coupled with the fear of complications, often weighs heavily on the entire family. As awareness of diabetes grows, so too does the understanding that this chronic condition, while serious, is not an insurmountable obstacle. Community-based programs led by healthcare professionals, community health workers, and individuals living with diabetes are playing a pivotal role in shifting the narrative. These programs provide a safe and supportive space for people to share their experiences, learn about diabetes management, and access resources that can help them live healthier, more fulfilling lives. More and more individuals, like me, are stepping out of the shadows of silence, breaking free from the stigma that has long shrouded diabetes, and embracing a message of hope and empowerment. A tapestry of resilience weaving a healthier future. Across the vast and diverse continent of Africa, a tapestry of resilience is being woven, thread by thread, community by community. From bustling cities to remote villages, individuals, families, healthcare providers, and policymakers are joining forces to combat the diabetes epidemic, one step at a time. Governments are recognizing the urgent need for increased investment in public health infrastructure, particularly in low-resource settings where access to quality healthcare remains a significant challenge. Initiatives to expand health insurance coverage, establish mobile health clinics, and train more healthcare providers in diabetes care are gaining momentum. The private sector is also stepping up to the plate, recognizing the economic and social imperative of addressing diabetes. Companies are developing innovative technologies to improve diabetes management, from affordable blood glucose monitors to telemedicine platforms that connect patients in remote areas with healthcare providers. The time for action is now, a call to unity, a promise of progress. The fight against diabetes in Africa is not a sprint, it is a marathon. Let us answer this call to unity with hope and belief in collective action. Strengthen healthcare systems for quality, affordable diabetes care. Celebrate resilience like Kwame's, guiding others to a healthier future. The time for action is now. Please don't forget to like, subscribe, and share my video.